we are looking at the Conus medullaris syndrome, and this is versus the cauda equina syndrome. So to start off with some questions, the first question is, discuss the pathophysiology of the Conus medullaris syndrome, whether it is upper or the motor neuron involvement. And second will be, what about the reflex in case of the cauda equina syndrome? So in this video, we'll find the answers to these questions and learn in detail about differentiating them. So to begin with, firstly we are going to look at the Conus medullaris syndrome. So in short, I'll be writing as CMS. And then we'll be discussing about the cauda equina syndrome, that is a CES. So in case of the CMS, what about the injury? So in CMS, the injury is nothing but with the vertebral. It is with the vertebral column. There is vertebral column injuries. So the injury is between. So this injury is nothing but between the T12 and the L2. Next, when we see the CES, that is cauda equina syndrome, the vertebral column injuries is in the vertebral column injury. So this injury is it is distal to the L2. It is distal to L2. Then we move on to the pathophysiology. So in terms of the CMS, as called the Conus medullaris syndrome, it is basically the upper as well as the lower. So it is upper and the lower motor neuron involvement. Whereas in case of the CES, it is just the lower motor neuron involvement. Next, we are moving ahead with the motor strength. So how is the motor strength? So in terms of the motor strength, it is a symmetrical motor impairment. There is a symmetrical motor impairment. And in case of the CES, it is the asymmetric. It is asymmetric motor impairment. Then when we see the reflex, so what about the reflex? So in case of the reflex, the knee jerk is preserved. Knee jerk is preserved and the ankle jerk is affected. Ankle jerk is affected. So knee jerk is preserved, the ankle jerk is affected. This is important to note. And on the cauda equina syndrome, there is basically both the knee and the ankle are affected. The knee plus the ankle, both are affected. If you see both, they are affected. Then we'll jump on to so now we finished the MS, that is the motor strength and the reflexes. Lastly, we are looking at the sphincter dysfunction. The sphincter dysfunction. So in terms of sphincter dysfunction, under the CMS, there is the urinary retention. There is urinary retention. So this presents early in the disease course. So it presents early in the disease course. Next, in CES, that is the cauda equina syndrome, there is a urinary retention. There is again urinary retention, and this presents late in the course of disease. So this appears late. Now we'll be answering our questions. So the first question we asked was in terms of the conus, in terms of the conus medullaris. So the conus medullaris syndrome. So in terms of the conus medullaris syndrome, what is the pathophysiology? This was the question we asked. So in terms of the conus medullaris syndrome, the pathophysiology, it involves the upper as well as the lower motor neuron involvement. So it has the upper as well as the lower motor neuron involvement. Next, we asked the reflux. The second question we asked was about the cauda equina. The cauda equina syndrome. So in terms of the cauda equina syndrome, what are the reflexes? So what are the interpretation of the reflexes? So here the reflexes, the knee, you see the knee as well as the ankle, the knee and the ankle jerk, knee and the ankle jerk, both are affected. So this was about finding the difference between the Conus medullaris syndrome and the cauda equina syndrome. To learn more, please do subscribe.